So the question I get very frequently is, can PEDs actually help? What are they going to do? And the extent at which they can help is largely going to be dependent on the process that you have in place. It's how well you use them, whether you're using the correct dose, whether you're using it for the specified reason that it's best used for. There are people, and I'll close this loop. There are people that will use Anavar because they're specifically told, they're like, it's a fat burner, it's female friendly, it's risk free, it's going to help you preserve muscle. Anavar, compared to other anti-catabolics or fat burners, it's very risky. It is not risk free. It still poses a risk of virilization, and you can't assign like how many anabolic steroid cycles you get in your lifetime, but there is a limit. So we're each given like a limit of how many times and how many milligrams we can take throughout our entire life before, as women, things start to get weird and they start to change. You start to develop changes in vocal folds. Things, they just don't sound the same. You could very well develop clitoromegaly. There are defined ranges in which this is, diagnosed. And truly, when you're looking at someone who, I'll kind of get into why people take these things to begin with, but if you're looking at someone who's using, let's say, a steroid, an anabolic steroid, for the purpose of preventing muscle loss, to me, like what that screams is like your program must be so shitty that you need something so strong to prevent you from muscle wasting. Because, like, keep in mind, Anavar, for instance, that is clinically, it is FDA approved for muscle wasting diseases. When someone is in such a critical state where they're in an ICU bed, burn victims, severe trauma victims, HIV patients, cachexia, these are things that you're not lifting, you're not eating, but this is what they can do. This is essentially the route they can take to prevent you from wasting away. So when someone tells me like, okay, well, I'm using this in a state that is non-muscle wasting. I'm using this in a fat loss phase, or I'm using this in a state at the end of contest prep. It's like, okay, it's going to help you prevent muscle loss, but your program shouldn't be encouraging so much muscle loss that you need something like Anavar or an alternative anabolic. And on the flip side, if we're talking about T4, T3, Clenbuterol, if you're using these things to drive more fat loss, if you're using them to expand your deficit, which I largely think is a good reason to use these things, yet you're not taking inventory of how much you're eating, you're kind of fucking off on your diet. You're having bites here and there, you're having untracked meals and they're turning into major overages, or you're skipping cardio, or you're making like pretty hefty guesstimations on your macros. These are things that are going to help with fat loss and help create more of a deficit. But like for each one of these, like at a reasonable dose, you're only creating like 100 calories more of a deficit. It's not going to do nearly as much as you think if you're not crossing your T's, dotting your I's. And that's the thing. Many people, they will put these in place with expectations that they can get away with more. And sure, yeah, you can get away with like 200 calories more, but it doesn't change the landscape that like you want to lose weight. So you're still going to have to be in a deficit. And if you have to be in a deficit, don't use those tools as like this 200 calorie slush fund for you to just like fuck off and eat whatever you want. And 200 calories, like, what are we talking about? That's like 2 tablespoons of almond butter. Like, it's not really going to go far. So, and I probably should make this into a video where we do graphics. Maybe I'll do that next. But when we look at like the pros versus the cons, the pros are that you have tools that can enhance fat loss, they can enhance muscle building. And when you look at something like Clenbuterol, there are benefits to using it in a fat loss phase outside of fat burning. It does have the potential to work as an anti-catabolic. There are pathways that would suggest it can result in hypertrophy. To the extent that an anabolic will result in hypertrophy, no. But for someone who's never touched an anabolic, maybe those benefits feel pretty significant relative to what they've experienced before. Now, the part that I think a lot of people find so enticing, especially men, is that there is a component to using drugs that, and specifically anabolics, that allows you to push to a potential that either would take like a great amount of work and a great amount of time, just such a large commitment that might not be possible, or quite literally, it can help you build a physique that, like, chemically, like physiologically, hormonally, you wouldn't have the right formula to create. So when you look at like men using anabolics, men using testosterone, creating an anabolic state, a state where they can put on muscle, it's far and few who are going to be over 1,000 nanograms per deciliter for their serum testosterone levels. Yet with TRT, that's something that many men can achieve, and it can completely transform their physiques. It can give them physiques that, I mean, objectively, they wouldn't be able to attain nor sustain, especially through the natural aging process. Now, the same applies to women. As we age, like, we know that these hormones are going to downshift. We know that we're going to see testosterone levels begin to decline. And for some, it doesn't take long. Like, if you live in a very stressed, very suboptimal state hormonally, we can see these things happen as early as someone's 20s. I mean, in some cases, even if someone starts hormonal birth control in their teens, they might not ever achieve what we would consider normal to functional levels of testosterone. Now, when we look at the cons, I mean, there are very direct health outcomes that can occur from using both anabolics and non-anabolics. And what you have to understand is that not all drugs carry the same risk. And even within the subcategory of anabolics, oftentimes you'll see that there's a big discrepancy in the accuracy of the compound. So even if, let's say, you find a source, maybe you're able to get this without a prescription, and in many cases, you're probably going to have to. But let's say you find a source that has, a low dose of, or a low concentration of primobolan or mastron that you have heard is very effective. We can't be 100% certain that it's actually the drug that we think it is. We can't predict how it's going to interact within your body as a biological female. And there's the accuracy component that is very important, because oftentimes when these things are not the drug that we hope they are, they're something of lesser quality or something that comes with more side effects. And specifically for women, this can typically result in irreversible effects. So the flip side of this is that even if it is the drug that you think it is, even if it is farm grade Anavar or, 100% primobolan, you're not guaranteed that it's going to interact for you the same way it has with others who, maybe you're going off the source, vouching for their product, which I'll just say, if someone is at all doubtful of what they're giving you, if there's any kind of consideration that like, oh, I think it's pretty good, but I'm not sure, every non-prescription drug that you source, you should have supreme confidence from who you're sourcing from. If that source is at all questioning or finding that, it's a hit or miss how this interacts with women, I wouldn't pull the trigger. I would look elsewhere. But what about in the case that you're going off of word of mouth? Maybe you have a fellow friend, a competitor, someone that you've spoken with whose girlfriend has used this drug before from this specific source. You can't be certain that it's the same batch. You could ask, sure, but truly, there is a limitation on how much information you're going to get. Even then, we don't know the quality in which these drugs are stored, the shelf life, if there's been degradation. And that's, again, all assuming that it's the same drug that you think you're getting. Now, past that, really the issue comes down to the fact that your hormonal landscape can be vastly different than a friend of yours, someone else who also is of the same gender who's used this drug. And there are specific components, I would say, on labs that can give you a good idea as to how sensitive you're going to be to exogenous androgens, so androgens that you're putting in your body. So the other layer to this is that I don't see a lot of coaches, a lot of providers even going the extra mile with their female clients and saying, like, yeah, if we're going to put this in, like, we need to confirm that your circulating androgens are fairly low. We also need to confirm that you don't have any kind of history of high free testosterone or high DHT. We also generally want to look at the ratio of androgens to estrogens. So, in the state of a fat loss phase, at very low body fats, people typically see that circulating estrogen does go down. Now, the ratio of androgens to estrogens can strongly impact how someone is then affected by exogenous androgens. It doesn't just matter whether or not someone has a suspicion of PCOS or if they've had a history or familial history of that kind of diagnosis. Truly, we need to see that the individual is in a healthy enough state so that there's lower risk. And I personally, I would like to see this confirmed before they introduce it, because once it's in, if the effects are too great, if they're too aggressive, then really all we're left to do is remove it. And for some people, this can be really upsetting, like the effects of an androgen that's just way, way too strong, especially in the case that someone has a history of acne. If someone just genetically, if they're more prone to growing darker hair, if they have history with like growing like the pesky chin hairs, upper lip hairs, facial hair, if that's something that you've struggled with in your life as an adolescent or into adulthood, these are things and they're clues that would indicate that we need to be very conservative with putting any exogenous anabolic in place. Now, the other major con that I think a lot of people they don't realize they're signing up for is that once you start using PEDs, you're probably going to feel dependent on them. And it can be very difficult to not use them once you have. And frankly, it's just not safe. These are not over the counter supplements for a reason. Some of them have very, very high risk associated. And if used not with any supervision or under poor supervision, you can very much end up, as a female, you can end up with irreversible effects. I mean, you can encourage the early starting signs of a sex change, which it's insane to me that you have providers that are witnessing it. They have front row seats and they're the ones, writing the script saying that this is okay. And they're justifying it simply because the individual is having better workouts. Their libido's improved, yet they're not putting preliminary safeties in place so that the patient can track. Is my voice changing? Am I having anatomical changes? Do I still have the ability to walk this back? Or is the plan for me to just stay on Anavar indefinitely for my libido? That's a real story. Like, I've had this happen not just once, but several times where providers just gave someone an anabolic for low libido and were told, like, yeah, this is like your version of Viagra. Never at any point actually walking the patient through, there is going to be a point where things start to go south and you start to sound different, you start to look different. And that's not something we can reverse at that point.